Welcome to Breathe California TV. Breathe California is the lung health organization for the state of California. We have 6 chapters throughout the state. Our guest today is Jason Cross, who's a staff member of Breathe California, and he specializes in handling issues related to smoking. A good summary might be, if you don't smoke, don't start. If you do smoke, listen to Jason for the rest of this show, because he's going to walk you through how to stop. So we'll be back with Jason after this public service announcement.
It's given me a chance to get out and be with people who has the same problem, and it helps you to manage your life better too, because you hear different things from each person, and it's just been really helpful in many ways.
Welcome back. This is Breathe California TV. My name is Terry Trumbull. I'm a volunteer with Breathe California, and Breathe California has had this show on TV for the last 30 years weekly. So be with us every Monday night for a good show like you're going to get from Jason Cross. Jason, welcome, and why don't you tell us a little bit about your background?
Thank you, Terry. It's wonderful to be here. I'm a health educator. I teach.
You're a health educator. What does that mean?
I help people quit smoking. I teach the Ash Kickers Smoking Cessation course. I also lead programming in the Peninsula Healthcare District in San Mateo County, including asthma, senior, and anti-vaping programs. I teach about the negative health impacts from vaping nicotine, smoking cigarettes, and/or cannabis use to middle and high school students. And I work in the East Bay on the AppyChat grant that addresses tobacco and vaping issues.
So what in the heck is vaping? I suspect most of our audience knows, but obviously you're trying to talk to a lot of people that are vaping or thinking about trying it. So what is it?
Good question, Terry. Vaping is when nicotine is heated up to a high temperature and inhaled into the lungs, and many parts are stronger and worse than the body compared to a traditional cigarette, and it's made more addictive by the higher percentage of nicotine inside of it most of the time. And our youth are really getting affected by it, I should say. So it became an epidemic, and that's what became scary. The reason it's called an epidemic is because all of a sudden the vaping epidemic caused youth tobacco use to go from 1% to 13%. So that got people like me, health educators, really worried. It's out of control. So Breathe California has been fighting on all fronts, getting policies passed to prevent the sales of flavored tobacco that lures youth to use it, alerting parents to the signs of use and arming them with the facts, and also implementing prevention education with youth.
So do your comments apply just to tobacco, or also tobacco and cannabis?
So I'd say both. Both have the firsthand smoke to the smoker, secondhand smoke to those around them, say in the apartment building. And tobacco and vaping both leave third-hand smoke for sure too, like residue on clothing. If you hold a baby afterwards, or a pet, or on the surface of a table, you can feel it and transfer it like that. Or something crawls across the carpet, like a child or a pet, they're going to receive the third hand from the carpet.
So I warned you that I might go off of our pre-planned questions. A lot of people don't understand when they live in an apartment what happens to this smoke that they generate in their apartment.
Sure, that's a great question. So it can easily, it can go a couple directions, right? The person inhales it into their lungs, then the second hand can go out the window and into a neighbor's window. That's happened to me before when I lived in an apartment. It can also go through holes in the wall, like where the electrical outlets are, or the vents for the heat or the AC can go through those holes into the neighboring apartments next door or upstairs or downstairs. So there's a lot of ways it can spread and affect others negatively in the building and outside of it.
Well, you hinted a little bit at this when we started, but how did you get into doing this? This is not the kind of job that my college counselor would have told me how to consider doing.
That's true. That's true. I know. That's a great point. So this work's very important to me on a personal level. My mother and father, they're both ex-smokers. My dad was a heavy smoker at 2 packs of Lucky Strikes a day. My mother lost her father to smoking before I was even born. So this prevented me from ever meeting my grandfather. And then I'm an ex-smoker myself. I started smoking when I was 15 years old, sophomore year of high school. My friends around me were all doing it, and I wanted to fit in, to feel part of the group and cool. So I started. And little did I know how difficult it would be to quit. Almost like a bee trap, easy to enter and tough or near impossible to exit. Luckily, I quit a year later when I got sick. Looking back, most of my friends from high school still have not quit 22 years later. And quitting is not easy, it's hard work. Those 72 hours of withdrawal, those 3 days, were like torture for me, and I'll never forget the struggle. And when I quit, I did not know that nicotine replacement therapy existed. So that made the quit more difficult than it had to be. And now 22 years have passed since quitting, and quitting is still one of the top 10 accomplishments of my life. And I help other smokers quit and encourage the use of nicotine replacement therapy during the process.
So you mentioned nicotine a couple of times. Is that the key component of tobacco smoke that is addictive?
Yes. So nicotine has been compared to heroin and cocaine on being super addictive. And some people will go to drug rehab and get off several drugs, but not be able to kick nicotine because it's so addictive. So the nicotine replacement therapy comes in really handy because the body doesn't like to go through withdrawal from it. It gets withdrawal symptoms include irritability and other uncomfortable symptoms that the smoker would rather avoid if possible. And that's why quitting is often postponed indefinitely. But when people use these things like nicotine replacement therapy that comes from like Nicorette, or Costco has a brand and CVS and Walgreens sell it. So this is over the counter. You don't need a prescription. And there's the patch, the gum, and the lozenge. And all these things contain nicotine. And the purpose is for the smoker to receive nicotine in their body without harming their lungs in the process, right? And then you want to wean off of it slowly. So the amount of nicotine consumed with this NRT, nicotine replacement therapy, is slowly reduced over several weeks until it reaches 0. And that's what leads to the quit.
Well, that sounds absolutely great. There isn't anybody terribly eager to go through some of the terrible physical feelings you'll feel in dumping whatever your addiction might happen to be. So I got sent out once to teach a smoking cessation class. There were about 10 or 12 people there at a local business, and I got eaten alive. I definitely was not prepared for it. I'm not quite sure why I got sent out, but they were definitely a group that wasn't terribly eager to hear the message of how bad smoking was. They wanted to hear how to quit, and that means that you've had some training to get to that point, right?
Yeah, definitely. And that's a good point, Terry. It's hard because as a smoker, I know I'm harming my lungs, right? And there, for me and other people have told me there's some shame involved, or some guilt, or um, feeling upset that haven't been able to quit yet. And quitting is hard. So these cessation classes or quitting classes are so important. And it's hard to commit, right? So cessation classes are few and far between because it's hard to get those who smoke to commit to quitting, because quitting is a stressful process. But Breathe California still tries to do it. Last year, 21 smokers or vapors participated in the 6-session behavior modification tobacco cessation program, Ash Kickers, delivered virtually due to the pandemic. So there was 3 sets of these 6-session courses. I had 21 total participants across the classes during the year, all hardcore, longtime smokers, a lot of people multiple decades, and they had already tried multiple ways of quitting over the years. And 4 participants were able to quit using tobacco completely. At the 3-month check, they were still quit, and 11 cut down significantly and stayed cut down. So the 4 adults successfully made the life-changing transition to a non-smoker, and 11 significantly reduced tobacco and or marijuana use after their 6-session Ash Kicker behavior modification tobacco vaping cessation courses.
So where did you teach your courses?
Virtually, due to COVID, and people really enjoyed the flexibility of that, being able to join from home without having to drive in. And I used the mail to mail documents and other supplies for the class.
So most of our audience is San Jose and Campbell, and Breathe California is right smack in the middle of that area, Breathe California, the Bay Area. How would they learn about classes that are closer to home?
Sure. They can go on the website if they're interested in the classes.
So both you and I have the website under our names, lungsrs.org.
That's great. Yeah, lungsrs.org. Perfect. Exactly, Terry.
So in spite of me mentioning San Jose, all they have to do is get into a class and they can do it from their home.
Yeah, and a lot of people enjoy the convenience of that, I've been told over the time.
Well, Breathe California in general, I'm taking a separate plug away from your programs, is very happy with Zoom. We've been trying to get people to telecommute to their jobs because 85% of air pollution in the Bay Area, which is probably the single worst thing for most people, is coming from air pollution from cars. If an individual smokes, there is no doubt that that's much nastier on their health than air pollution. But you have any numbers on how many of us are smoking these days?
Good question. And that's a great point about the air pollution in the cars. Thank you for bringing that up, Terry. Smoking levels for adults in California have come down over the years, although with the pandemic, things have increased due to stress level, and it's been a tough time for mental health the last 2 years over the COVID period. So cigarettes have been more popular with adults, while vaping has been more popular with minors and some young adults. And those numbers have really skyrocketed during the pandemic as well. And some of that is due to different influences like peers, what they see in the movies on Netflix and things like that.
So for people that used to smoke, is there something fond about that might have brought them back during the COVID epidemic?
Yeah, stress management, right? And we talk about that a lot in my Ash Kickers class. We were talking about it yesterday on Zoom, actually. So stress management is kind of Well, it's a behavior modification class, and stress management is a type of skill that needs to be practiced and built, right? And if we have, if we're doing things like exercising or talking to someone, a friend or a loved one or therapist to express ourselves, or even just squeezing a stress ball to get through the day, those are all healthier ways to deal with the stress than going towards nicotine or smoking. But a lot of people will revert to old habits in times of stress if they don't have another item on their mind to go to.
So as a teenager, my daughter had a full-size dummy filled with air that she used to beat up to relieve her stress. So hopefully Jason will come up with something as amusing as that in the next 30 seconds. We're going to take a break for another public service announcement about Breathe California's program. So see you in 30 seconds.
My name is Rene Montez. I've been using the CPAP machine, I would guess 10 years. I got so accustomed to it, I don't go anywhere without it. I take it with me everywhere. From the moment I put it on, I thought it was the greatest thing because the breathing was a lot easier, and after using it for a couple nights, I felt a lot of energy. Breathe California is fabulous.
Welcome back. This is Breathe California TV. Historically, this show has been called Environmental Concerns, although today's show is much more specifically relating to making the environment of your life much better by stopping smoking, which prevention is pretty desperately needed in all areas of health, including this one. Breathe California is a health-based organization, and Jason Cross is a health educator. So talk a little bit more about the smoking cessation classes.
Sure. So I teach Ash Kickers, which is a 6-class smoking cessation course, and people join who want to quit or reduce smoking or vaping. And the behavior modification is important. And we were talking about stress management, Terry, and I wanted to comment on that. I encourage people to manage their stress different ways. And you have to think about how's our body doing? Where's our bandwidth at, right? Like, did we get enough sleep? Did we get enough food? Are we cold, warm, tired, emotional, things like that? And so taking a hike, going in nature for a hike, or just walking around the block in the city, get the blood moving can be useful. Other stress management, talking to a friend or a loved one or a therapist, those are very important. There's been a lot of mental health issue increases during COVID times the last 2 years, especially even for folks who have never had mental health issues before. So we use a lot of different tools in the toolkit to learn how to reduce and go after the trigger cigarettes. Like what are the strongest cigarettes, right? Waking up in the morning after going many hours without nicotine, after coffee, after a meal, boredom, stressful moment, talking politics, when alcohol is involved, things like that. And we also talk about how to not relapse, right? And go back to smoking after quitting, which can happen it's just smelling a cigarette, or if alcohol is involved, or like at a wedding or something like that.
Well, I've got to tell my girlfriend we've got to quit talking about politics.
It's a good idea.
Your notes before we started, you mentioned something near and dear to my heart, which is when I was in active duty in the Army, they would give us breaks and tell us to go out and pick up the cigarette butts, which I thought was terribly disgusting, and why, as a non-smoker, I ought to be doing that when the culprits were pretty obvious. But that didn't stop us. We were all expected to pick them up. So you have a little story you wanted to tell about picking up cigarettes.
Oh, yes. Yes. So the clients or participants in the classes, they have different stories that they share about their experience. And so one person told me, I picked up a cigarette butt off the ground and put it in my pocket to smoke later. Then I asked myself, what the beep are you doing? Then I immediately tossed it in the trash. I figured out I was precious. There is only one of me, and no one can replace me. There is only one of me, and no one can replace me in life. That was a great quote from one of the students. Can I share some more quotes, Terry?
Please do.
I am so happy that I quit for my newborn. I don't want her to smell it on my clothes. I don't miss that dirty habit at all. I smoked for 35 years. It became innate, a habit. I've been talking about quitting for over a decade, trying to quit for over 2 years. The tools from Ash Kicker's classes were the foundation for myself quitting. Another student said, thank God I didn't have to pay for the classes because I probably wouldn't have signed up. Someone said, being socially accepted in today's world required me to quit. I was smoking in front of Safeway, and the security guard asked me to move away from the store across the parking lot. I did not want to fight it anymore, the addiction. It was me versus me. I don't want people to judge me, and Ash Kicker's class was great for that. Another quote, people need to understand that it's not always a quick fix. Thanks for teaching me great replacement habits, Jason. Another one, I'm so happy to have quit. I regained my sense of smell and my clothes no longer smell like an ashtray. The structure of having a class helped keep me accountable on a weekly basis. Jason is enthusiastic and supportive. Support from other smokers in the class is very important to me and was very useful. The facilitator is a nice guy. I rarely smoke a whole cigarette anymore. And the last one, I cannot afford to pay for it while raising my newborn, so getting it for free is a real blessing.
Well, I appreciate you mentioning newborn. My girlfriend is a grandmother and regularly sees her 4-month-old grandson. And there's no smoking going around, but I just couldn't imagine how bad that would be. Young lungs are growing lungs and far more susceptible to the poisons and toxics associated with smoking. And that's true all the way through 15, which is when you started, right?
Yeah, good point.
My senior year in high school, I was captain of my high school basketball team. And I had a friend who'd been 5'2", and I tried to get him onto the basketball team. He'd grown 10 inches, and God, did he have a great jump shot. To think that at 17, you might grow 10 inches. It's real important to understand that growing things are more severely impacted by smoking.
Well said, Terry.
So, tell us about the vaping epidemic. We've done some talk about it. Is there anything more that you wanted to say on that, other than don't start?
Yeah, the vaping epidemic has been really, it was kind of a curveball the way it came, because we were watching smoking rates going down with time, and then all of a sudden vaping got popular and went way up, especially for our youth, right? Especially middle school and high school students in the United States. And I go into classrooms and talk to students, and some of the students don't want to drink water because they don't want to use the restroom because vaping's happening in the restroom. They don't want to breathe it. So they're going all day without drinking, and administrators aren't sure what to do about it. Like, you can't put a camera for privacy reasons, or do you put an adult at the door or something? Like, Like how do you deal with that on campus? And it's not like a cigarette where it leaves the obvious smoke and smell necessarily, right? It's different. So it's been hard to figure things out in that sense as well.
So you have some interesting experiences I want to go off program on. How old do you have to be to buy cigarettes?
21.
So at Breathe California in San Jose, used underage people to go in and check whether they're following these rules, and they would come out and relate their story to the police, and they would be given tickets if they were selling to underage people. And I gather you did something similar to that when you were that young.
Yeah, I did, and that was a very satisfying experience. I was happy to be a part of that at age 16. Yeah.
So did you actually go into court and testify in any cases?
Yeah, one of them I did have to. A child, I think he was 5 or 10, sold to me. His parents were praying in the back, and they took it to court. So I had to go to court and testify for that one. Yeah.
So you're a health educator. What have you been doing for prevention? Obviously, the ash kicker classes are part of that. You're protecting people's health, even if they're already smokers, in educating them. But anything else you want to note?
Yeah, great question, Terry. So reaching the students is really important for me, reaching them before they start if possible. So we're supported by the Peninsula Healthcare District. And last year I taught anti-vaping classes at 5 schools in San Mateo County. This includes high schools and middle schools. And in total, 923 students at San Mateo schools received my anti-vaping / tobacco education in 2021. 923 students were provided services, many of them in person when schools resumed. 28 classes were delivered in English and 1 class was delivered in Spanish. And it's so nice to go into the classrooms and receive the comments and the feedback from the students and learn their questions. They have questions for me, what's okay for their lungs and what's not. So it's very satisfying work, Terry.
So we've got about 20 seconds left. What's your quick summary of our discussion?
If you don't smoke, don't start. If you are smoking, quit. And I've been giving you hints on how to do just that. Thank you.
Thank you very much for joining us, Jason. So this show will run 2 consecutive Mondays, and then we'll have somebody hopefully as interesting and appealing as Jason. See you then.